Maryland's Governor Wes Moore says he's fighting to keep health care affordable, a central part of the debate amid the current government shutdown.
But the governor's political opponents say any decrease in costs would be offset by the extensive taxes and fees already put in place at the state level earlier this year. Spotlight on Maryland's Tessa Bentula explains.
Democrats warn health insurance premiums could spike under the Affordable Care Act if federal tax credits expire at the end of the year. Those tax credits are essentially discounts paid by the federal government to help people afford their monthly health insurance. It's a key sticking point in the federal government shutdown. Governor Wes Moore's office tells Spotlight on Maryland, under this White House, Marylanders continue to see rising costs on everything from groceries to electric rates. And now Donald Trump and Republicans in Congress are holding healthcare hostage to keep the government shut down. But Republicans, including State Senator Justin Reedy, says Moore is making life more expensive right here at home.
I think we all would say that we don't want costs to go up for people. But that's why we've spent the last 3 years fighting against Governor Moore's dogged attempts to raise every tax and fee possible known to man in this state. We've had over 330 tax and fee increases since Governor Moore has taken office.
About $1.6 billion in new taxes and fees were added just this year. It was part of the state's plan to close a $3.3 billion deficit. Some of those charges include vehicle registration fees now at $120.50 for the average car. Emission tests are $30, up from $14. There's a new $5 tire fee. The cost of a fishing license has doubled from $25.50 to $52. Boating and title registration fees have nearly tripled from $24 to $70. That's on top of increased taxes on sports betting, cannabis, vending machines, and a new IT tax. And income taxes also went up for Maryland residents making $500,000 or more. All of that money adds up fast. Now compare that to healthcare premiums under the Affordable Care Act. Moore's office notes 190,000 Marylanders could see premiums increase an average of 95% next year. That's roughly $825 more a year, or about $70 a month.
I'm very concerned about healthcare premiums going up, but that, as you mentioned to me, $70 premium increase, there's been, hundreds of dollars for many people increases in their cost of living due directly to actions of Governor Wes Moore.
Congressman Andy Harris agrees.
Those COVID-era Obamacare enhanced subsidies affect about 7% of Americans. And again, the taxes and fees that the Democrats in Maryland have imposed on our citizens affect the vast majority of citizens.
Policy analyst Dr. Anirban Basu says rising costs push people to leave Maryland because they can't make it financially.
We want to be a state in which people say, I want to live here, work here, play here, retire here. But I hear so many retirees say, nope, I'm going to Boca Raton or Fort Lauderdale or Naples, Florida.
A new state report estimates 2 million people left Maryland between 2010 to 2023, citing the high costs of living.
Is the state and its leaders failing the residents?
They have been for years. I don't think the residents have necessarily realized it until very recently, perhaps, that the state's economy is just not producing enough opportunity.
As the government shutdown continues, we'll soon find out if those healthcare tax credits will stay put or if Marylanders will have to pay even more money. Reporting for Spotlight on Maryland, I'm Tessa Bentula.
Hi, I'm Maxine Stryker. Thanks for watching. Don't forget to like this video and subscribe to our channel, and check out Fox Baltimore on social media to find more stories like this.